we're kind of like that extra set of hands.
But Judy Shuck, the Regional Healthcare Coordinator for the Eastern Virginia Healthcare Coalition, knows EVHC is much more than that.
It's a collaboration of healthcare organizations that come together for the purpose of saving the lives and preserving the health of our patients, our residents, our clients, and our staff in case of a natural or man-made disaster.
EVHC works with healthcare organizations and providers, public health departments, and community partners to care for our community before, during, and after an emergency. Doug Smith, the Emergency Operations Officer with Riverside Health Systems, has been a part of EVHC since it began. He is also the current chair of the EVHC Executive Council.
In normal times, you have your normal operational role and you fill a certain niche. But in a disaster, we kind of have to broaden our approach and we have to be able to collaborate and share resources across the entire continuum.
The Eastern Virginia Healthcare Coalition is able to do that because instead of focusing on the bottom line during an emergency, members of EVHC are focused on how best we can all work together to help the community.
It's a vital role in coordinating all the healthcare resources in the community. Sometimes these different organizations are in silos. All of them have their own unique mission, but they're all tied together, and the coalition is what makes that happen.
Having that resource that was funded by the state and having other communities to talk to has been wonderful.
Donna Marchant Roof, the Managing Director of Healthcare at Atlantic Shores, is so thankful that she found out about EVHC through the Tidewater EMS Council. While it is primarily funded through federal grants, TEMS acts as the fiduciary agent for EVHC.
I don't know that I could have gotten through all the CMS changes with emergency preparedness and emergency management and now rolling straight into COVID without their support.
So what does EVHC do when there's not an emergency? Help members stay prepared by conducting exercises, like this one on the campus of Atlantic Shores Retirement Community.
We landed a Chinook and we did a mock evacuation of our skilled facility.
Then they used what they learned to educate and help others.
We did presentations to the coalition on our experiences, our lessons learned, communication issues that came up, so that in the event we really have to do it, or anyone does, I can say, oh, well, this is what we came across. The fact that we get to practice that is a big benefit.
Putting EVHC training to use is something Glenda James with Fresenius Kidney Care had to do when Ice Storm Grayson came through, affecting their clinics on the Eastern Shore.
We actually contacted the Healthcare Coalition and used our emergency planners and the Emergency Operations Center to help us get our patients as well as their employees to the clinic.
With the help of EVHC, they were able to get the National Guard to help transport patients and employees.
It's better to have training and preparedness and know your resources ahead of time instead of trying to figure that out in the middle of an emergency. We're all in this together to provide good care for our patients, and we share patients within so many of these entities. So it's vital for patient care and safety.
We never know, given day to day, what we're going to be asked to support.
But because of the connections established through EVHC within the healthcare community, members are prepared no matter what happens. It's a networking organization that benefits everyone involved.
We can help by simply orienting them to the region. Like, who are your partners? Who can you reach out to? Who are all these people that they need to make contact with?
The Eastern Virginia Healthcare Coalition is open to any healthcare organization in our 27 jurisdictions, from Accomack County to York County. Participation is critically important to everyone involved.
You have to participate to get what you need.